We're looking at this week's health headlines, including sugary drinks versus artificially sweetened beverages.
Joining us now is professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Thanks for being with us.
Good morning.
All right, let's start with the sugar-sweetened beverages versus artificially sweetened.
Yeah, this is one of these ongoing controversies, quite frankly, makes people crazy.
Yeah.
You know, is the artificial sweeteners good for your health or bad for your health? So to answer this question, there was a very large study. Over 900,000 adults were enrolled in this study. And they watched them for 28 years and looked at a lot of health habits, including were they using sugar in their beverages or artificial sweeteners. And after 28 years, 135,000 of them were diagnosed with one of 20 kinds of cancer. So that was a lot of good data because they were able to look and see the associations. And this is what they found. In the group that was using real sugar in their beverages, there was an increase in cancers that are associated with obesity, things like uterine cancer and breast cancer. But when they eliminated the overweight factor, they found that the sugar in and of itself was not what was causing the increase in cancer. But then you turn to the artificial sweetener group, and they also had an increase in these obesity cancers. But when they eliminated that factor, they still saw an increase in cancer, specifically pancreatic cancer, about a 5% increase. So there does seem to be an association with artificial sweeteners and potentially pancreatic cancer. But one caveat is they didn't look at all the artificial sweeteners. And one of the newer ones out there, stevia, a lot of experts think that it does not have the same issues. So bottom line, put a little sugar in your coffee. It's okay. And if you're going to use an artificial sweetener, you're probably better off using stevia.
So which one was the one causing the problem? Is it NutraSweet or whatever's in the soda? Which one is it?
There were about 4 or 5 that they looked at. Saccharin was at the top of the list.
But that's not really in sodas or anything anymore.
Not as much, but it's still out there. It's still out there, and it does seem to promote tumor growth.
Gotcha.
All right, a study that shows an alarming decrease in sperm counts.
Don't be alarmed. That's the take-home message on this. But it was interesting because what they found is over the last 48, 50 years, there's been a 50% decline in sperm counts, which has accelerated most recently. So there's been a lot of chatter about this in the medical circles, and it kind of is like, oh my God, this is overstated. Don't worry. The techniques that we have to do semen analysis are so much better and different today than they were 30 years ago that you're really not comparing the same thing. And then there are the ones that have this doomsday, this is going to be the end of mankind if this continues and we have to figure it out. But what you have to keep in mind is guys make a lot more sperm than they need. And even with this 50% decline, it's pretty much still in the normal range or the low normal range. So we're not seeing a big impact on fertility per se, but perhaps an impact on the amount of time it takes someone to get pregnant. So this is really important. Number one, we need to figure out why this is happening. Is it environmental? Nobody really knows at this point. But when couples are struggling with fertility, the focus is always on the woman. She's the one that's getting all the testing. She's the one that's going to the doctor. And it's really important for there to be an early semen analysis because just as often there could be something going on with the guys.
All right. Here, an alert from the CDC of a drug-resistant infection.
Yeah, Shigella. So Shigella is a bacteria that can cause a diarrhea, but not just any diarrhea. It's a really nasty diarrhea with lots of other symptoms. And Shigella has been around for a long time, and it is associated with close contact, and it can be foodborne and associated with sex. But it hasn't been a big deal because in most cases it either goes away on its own, and if it doesn't, you can give an antibiotic that will get rid of it. Well, the CDC just put out an alert a couple days ago saying, okay, big increase in Shigella, and the reason is because now it seems to be resistant to the commonly used antibiotics. So if you are having a nasty diarrhea and fever and stomach pain that's not going away, get in there sooner rather than later, get a culture, and everyone has to still be really good about hand washing. I think at the peak of COVID, everybody was really aware and doing a really good job of washing their hands, and people, you know, just like masks and stuff, have gotten lax. Well, infectious diseases don't go away even if it's not COVID.
So is there any place in particular where you pick up Shigella?
Yeah, bathrooms
okay.
And intimate contact, and it is associated with travel diarrhea as well. But we're seeing it domestically increasing.
All right. You can check out Dr. Streicher on social media. Thanks again for being here.
Thanks, Doctor. Time now for On Time.
Hey, Anna.